Hi there, I'm Dr. Christine Anderson, or Dr. Chris as my patients call me, and I am going to come on and talk to you a little bit about stress, and in particular, stress in regards to how we find out if stress is injuring us and even maybe killing us. So, we throw the word stress around a lot. Like, I'm so stressed out. And, um, you've got to manage your stress. And I will also put a link to my stress management video I did last year. But the main thing is that current medical research is now claiming that 90% of all illnesses are the result of a lack of the body's ability to reestablish normal balance. And if this is occurring, then we need to know what stress is doing in our body. And this is where the stress response evaluation comes in. So, is stress killing you? I'm going to take you on a little journey, a little saga, if you will. So you can just relax and close your eyes or have a look at my visual there of the stressed body versus the relaxed body. And this is really a saga of the sympathetic versus the parasympathetic nervous system. And these are two parts to our autonomic nervous system that automatic when you think of autonomic. In general, we don't think about this. We don't go, okay, I've got to beat my heart and I've got to send info to the liver to detox and I've got to digest some food. And, if we had to do that, that would be an impossible job and actually live our lives. So this is where the autonomic nervous system comes in. And this is where the saga of stress really starts. So imagine you are crossing the street. A car races around the corner and it's headed right towards you. In an instant, your fight or flight or freeze sympathetic nervous system takes over. Your brain produces beta waves as it calculates what to do. Adrenaline and cortisol floods into your bloodstream. Your heart races. Respiration shoots up. Muscles tense. Your hands get clammy and cold. Your survival depends on how quickly you can sense this danger and how well your brain is able to control and coordinate all those different body systems in order to appropriately respond. Because this emergency system is in place, you're able to jump out of harm's way and you are saved. And so here we go, rah, for the sympathetic nervous system. Because without it, we would probably not be here as a species. It is part of our survival system. Now, once the danger is past, your parasympathetic system takes over and brings everything back to relaxed and a normal resting state. This is where you can digest and have romantic feelings, etc. How healthy you are is determined by how appropriately you respond to that chemical, physical, or emotional stressor that's creating that sympathetic response in the first place. And once that stressor is removed, how you recover. How long does it take for your system to get back to that normal resting state? So this is critical in what we're talking about. And not all stressors carry with them life or death consequences, like almost being run over by a car. But what happens is even some of these daily stressors, like deadlines and traffic and your poor posture and a crying baby and lack of sleep, too little exercise, air pollution, water pollution, other toxins, those internal things like negative self-talk and those low frequency emotions, relationships, financial issues. I could go on and on and on and on, but these stressors are the things that you need to adapt to on a regular basis. And this is, more of a thing that we're dealing with than in the past as we were evolving, running away from like a saber-toothed tiger or, whatever, that type of thing. This is more of a 21st century issue that we have these 24/7 stressors. And now, even we've added things like Wi Fi and EMFs where they're just present all the time. So it's a lot to think about, but what you do to adapt to this in an appropriate manner for the situation is going to require a change in your nervous system. So, as incredible as your self healing is and your self regulating body is, over time, repeated chronic or acute stress, if you're in one dangerous situation after another, if you're on a roller coaster of life, can overwhelm your body systems. And there's a delicate interplay between that sympathetic nervous system, which I liken to a gas pedal. So, go, 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 do, like you're on. And the parasympathetic system, which is more the brakes, like, okay, let's just, relax a little. Let's just take it easy. Let's just take a moment, take a breath. And so you can become imbalanced, and that can lead to an over-aroused system, under-aroused, or an unstable nervous system. So here's some of the health consequences of chronic stress, and it can affect your brain. This is huge on the brain. Memory loss, energy, headaches, dizziness. So many things can occur with the brain when you are under chronic stress. Your heart. So this is huge because heart disease is the #1 killer of Americans. And we don't often think about, what are we doing with stress? People say, oh, lower your stress. Well, what does that mean? And what is going on in the body that I need to work with? And how do I even know if stress is affecting me? It certainly affects your stomach. Think about having an upset stomach when you're stressed, or you're overeating because of chronic stress, and your immune system is depressed with stress. Joint pain, muscle pain, pain in general, and what happens with our hormones is also affected by stress. And not only that, but also fertility, because if your system is chronically stressed, like you're in survival mode, guess what? It is not going to be receptive to being in fertility mode. So there are so many health consequences to chronic stress. So it's one of the things that we don't often think about. So with this state of your nervous system, as we talk about, are you in a balanced state? Are you in a exhausted state? Are you somewhere in between that's unbalanced, either under-aroused, over-aroused, or unstable, which is kind of a combo of the two? And if you would like one of these little check box systems, just let me know. I can get one to you, either physically in my office, or I can certainly send one over to you. And you can fill it out and see where you think you might be. Okay, are you grinding your teeth? Having anxiety? Having problems with sleeping? Well, your system's imbalanced and it's more over-aroused. Do you have a child who has poor attention, poor concentration, or maybe even you can't focus, you're worried, you're irritable, you have low energy? Well, your system is probably under-aroused. So this is just a good way to get an idea. And then, is it exhausted? Do you have some of these really severe issues like diabetes, cancer, chronic fatigue, autoimmune issues? That means your system is just overloaded and it is beyond stressed. And this is really not a great place to be, because not only are you not having a vibrant, optimal life, but you are, 1 foot headed in the direction of not being on this earth in physical form anymore. So yeah, once you have an exhausted nervous system, your health will have declined so dramatically, because your brain has basically lost control of what is happening in your body. Our brain is our top-down control and tells the body what it needs to do, how it needs to do it, coordinates everything. So an exhausted nervous system is just like, it's like deaf, dumb, and blind, like covering the ears, covering the eyes. I don't want to listen to you, brain. I'm just done. And usually at this point, people are taking multiple medications, which have their own side effects. So you can see how things start to spiral downwards once your nervous system becomes in balance. But, don't despair. I don't want this to be a video of despair, because there is a way to regain your health by working with the nervous system and finding out what is going on in your body, not only at rest, but what happens when you are challenged physically, cognitively, and emotionally. And so here is a graph that shows the different aspects that are checked with a stress response evaluation. It's a 12-minute computerized test. It can be done as young as a child who is able to sit for 12 minutes without moving. So that's going to vary. There's some kids that are really great, and maybe I can do them at 4. Others might need to wait till later. But basically, we're looking at what's going on with the heart rate, respiration rate, skin conductance, so the galvanic skin response, heart rate variability, which is a huge one that looks at how your heart is responding. It's that balance of the sympathetic and parasympathetic when you inhale versus when you exhale, and that's tied to this heart rate variability. Muscle contraction of the trapezius muscles. And then I'm also putting 2 electrodes on either side of the hemisphere of the brain. And that is looking at the different brain waves, the beta waves, alpha, theta, and also the SMR, which is a type of beta wave, and looking to see what happens in the brain, and is it symmetrical when you are challenged with those stressors. Not only that, but we can see, what is your recovery? Does it, do these things recover well, or do they get amped up once they're stimulated? So let's take a look at that. Here's an ideal response for the stress response evaluation. But at the top, you're going to see the brain waves, and you can see them lined up there. And the green, dark blue, and the pink are those challenges, the responses to those. And I'll do a separate video just looking at this evaluation and go into more depth. But what I'm looking for is these typical patterns that should happen. And I'm looking for symmetry on the right and the left side of the brain to see if there's any difference. And this is what I do as a functional neurologist, looking at the hemispheres, because if there is an imbalance in the hemispheres, then it is going to matter what you might see, for instance, in a child with difficulties. And I'll put the link to my functional disconnection syndrome video in there, because it talks a little bit more about the hemispheres. So you can see there the heart rate variability. If you want that just in the center, showing what's going on with the heart rate, the skin conductance, the temperature, respiration rate, and then the sEMG or static EMG, which is looking at what happens to the trap muscles when you're under stress. You know, most of us want to wear them like earrings. And this is all subconscious. So, you know, you think you're doing really well. When I first did this, I was at a neurology conference, and I thought, oh, yeah, this is a piece of cake. And when my beta brain hit those challenges, it was hyper alert. So there's something to be said for an optimal level. It was kind of like, what's going on? What's happening? You know, you want your brain to be able to have those shut off times. So I was really intrigued by this, and I was like, wow, this is really crazy because I didn't feel stressed. I was at a conference, you know, there was a lot going on, but there's always a lot going on in my life. But I didn't really realize how much my brain was like super turned on, which means that my sympathetics could be a little out of control. So it is good to know where you're at. And then as remediation, there's ways to do bio and neurofeedback. So this is a way that we can help get into balance. There's also other ways to do it too. So there's some things that you can do with biofeedback, just putting your intention there sometimes. And I will go into more detail specifically about what biofeedback is and how neurofeedback works. But in general, for this presentation, with the biofeedback, you're having changes in your body with what you are doing. And I do this on the computer. There's a program that I use, but you can even just use it where you're doing visualization and intention in your own life and see if you can make changes. With the neurofeedback, it's changes in the brain, in the neurologic system. And this is through the computer program, and it's specifically personalized for which areas are being affected. And this is reinforcement through visual and or auditory. You can use both. Stimulus and operant conditioning, meaning there's a component of the person doing the neurofeedback. So your brain is learning as you are actually doing the program. And you can't do this consciously. You can't like will it to happen, but it's by the brain seeing the results of what's going on for the program that's in the computer. And then as it learns, oh, when I, you know, have this brainwave, this is what happens. And it really is pretty incredible how fast the brain does learn so that it can process, adapt, and tolerate more stress. And that's really the key because stress is never going to go away, especially in this day and age. We can try to lessen our load a little bit. We can do things like chiropractic, massage, yoga, meditation, vibrational work. There's so many things you can do to help mitigate stress, but it's never going away. But if you raise your tolerance and help your ability of your brain and your body to process and adapt to what's going on, then that's going to be a better way because the threshold will be much higher to hit before your system starts to break down. So neurologically based chiropractic, that is what I am. I am dealing with the nervous system. And the reason why I impress this is because there are different facets of chiropractic. There's one philosophy, but there's different chiropractors out there who work certain ways. And in my practice, I'm always looking at the brain and the nervous system. So you can see there's brain waves there, you know, there's your brain, and this is your brain on chiropractic because it really does help with this coordination of the top-down control and feedback from the rest of the body. So no matter what else you do, it is going to help your brain function at a higher level. So if you would love to come in and schedule your own stress response evaluation, then go ahead and contact me at my website, losangeles-chiropractor.com. I will do an SRE session takes about, 12 minutes, but it's some time for setup because I do have to put all the electrodes on and there's little things on your fingers and on the shoulders. So it takes some time to set up and break down. Um, but it is a great way to see what is going on in your body with stress. And then I can set up a program for you to do neuro and biofeedback if that's something that you're interested in. So thank you very much. And if you have any questions, you can always reach out to me through my website. Just contact me through there. I will get back to you. And otherwise, I will see you next time. Bye.